Knowledge is the best intervention. I think you'll all agree with me. So let's welcome Dr. Samarjit Dey, sir, to deliver exactly that on publications in pain medicine, consideration, trends, and future directions. Sir is consultant and in charge of pain medicine unit department of anesthesiology, AIIMS. Let's welcome, sir.
Good afternoon. I think I should not be the block between your lunch, but this was the topic was given to me, scientific publications in pain medicine. So actually it was a discussion between me and Das sir that what topic should I take, and I chose this because this is very important. Most of us are after the needle and the image in plane, out of plane, and we keep forgetting that we also need to publish to get the recognition that your procedure or the intervention should be going globally. So no disclosures to make. I come from the beautiful AIIMS-Mangalagiri, so I bring greetings from them. First of all, why should we publish? Why are we sitting in this hall and listening to the lectures and going back again with a lot of memories, but with no reports, no scientific content. So this content has to be published in the literature so that when you die, after 25 years, after 30 years, after 100 years, people read your work and know that somebody like you was there who has actually done something in pain medicine. So for disseminating knowledge, for building on previous work, getting academic recognition like people like me who are working in institutions, they will not give me promotion if I don't publish. Innovation and problem solving. Every day, Das sir will come up with some idea. One of us will come up with some idea. But if you don't publish it, nobody will recognize it. For getting funding and grants, again, institutions like us, if we have good number of publications, they will give us grants. Most importantly, policy and decision making. So the bureaucrats will not understand the in-plane technique of hydrodissection. They will understand how many percentage of the public is suffering from back pain. So for policy making and decision making, you need to come up with good quality papers to convince them, which is very difficult. So if I project the global trends in pain medicine publications, if you see, I have put India, it is in green color. We are striving towards the excellence, but not enough. Why not enough? Because most of us in this hall, we don't care about publications, right? So we want to read the papers, but we don't want to publish the papers. So it's time to change the seat and take the driver's seat for publication. You see China, Germany, Japan, UK, they all are ahead of us in pain medicine publication per se. In India, we do have a good quality publication, but they are not enough. So maybe down the line in 5 years or 10 years, we should try to bring India up. And having said that, what should we publish in scientific journal? So some novel findings, if we get some new interventions, some original research, yes, and some methodology should be included. We have all the patients with us. We see some 100 patients in OPD, but we have very limited data because we don't give to the time to the patient, but we don't record the data. So we need to record the data. And guidelines and consensus recommendation of the societies also can be published, and most importantly, to contribute to the field of pain medicine, we must publish. So what should be included in the manuscript? If we want to submit a manuscript, what should be included? So in a very brief manner, I have put it in the slides. So first of all is the title and the authorship. Like if you decide to publish something, you need to think about the title. It's like the attire you wear. Yesterday night you have decided what morning what will you wear, right? What is the color combination, whether it goes well with this or not, right? Most of us. So the title is like that. Everybody will read the title first. If they do not like the title, they will not read the article. So 2 seconds of their lifetime they'll take to read the title, and they will search also those keywords in your title if they are there regarding that topic. So a comprehensive title, it may have the following important keywords, like see, general, indicating the area and the specialty of the article it belongs to. Intermediate, referring to the specific disease or condition. Specific, referring to particular test or intervention. Having said that, this is one of the example of the title which seems to be almost complete. Effect of spinal cord stimulation on quality of life and opioid consumption in patients with failed back surgery syndrome. We have the general area, low back pain, intermediate, specific disease, failed back surgery syndrome, and referring to particular test or intervention like your spinal cord stimulation. They have also actually put up the primary objective of the study, like what is quality of life and opioid consumption. So this gives us an impression that what we are going to go through or read through the article. Abbreviations should be avoided, right? GON, ICN, all those things should be avoided. Some journals also require some short running title, and these days publication has become more standardized. We have International Committee of Medical Journal Editors. Whatever guidelines they have given for authorship criteria has to be followed before submitting the article. And we also, these are done to prevent the ghost authorship and honorary authorship, right? So, मेरा नाम डाल देना यार last में, please. ऐसे, अरे मेरा दोस्त है. So all those things are there. So we need to take care of those. And some journals, they require authors to declare their contributions as well as conflict of interest. So if you have submitted papers to journals, you will receive something called conflict of interest or some sort of this to declare it. So what are the important considerations for writing a manuscript? First of all, you need to think about the topic, build up the concept that I want to write or on this topic. And you have to choose the article type. Your study belongs to which article type? We have original article, we have case report, we have case series, and all those things. So we need to familiarize with the instruction to authors. Every journal, they have their specific instruction to authors, even though they are more or less similar. And we need to have a coordinated team. Alone, I can write an editorial or a case series or a case report, but not an RCT. So you need to build up a team. These days, teams are being built up to do systematic review and meta-analysis. We know that. And meta-analysis holds the maximum evidence in the field of, in the medical field. So preparing a skeletal framework for the manuscript is very important, and delegating time for thinking and writing in regular intervals. We cannot do it in 1 week or 1 month. It takes time. Parts of the manuscript, the first part is, again, after the title, if the person is interested in reading our paper, they will read the abstract. So abstract is the brief overview of the contents. It also has various parts like background, aim, material, method, results, and conclusion. So there is a word limitation for every journal. Generally, it is 250 words because people would not like to read longer for abstract. And there is, below that, there will be keywords. So these are 3 to 8 keywords which actually will be being searched. So that also should be there in your title. Then comes the main manuscript body, which follows a IMRAD protocol, that is introduction, material and methods, results, and discussion. So introduction, again, is a section which sets the tone of your article, and it has to be the general background of the condition, what is known so far, and a brief description of unknown aspects. Why have you thought to write about it or done a study about it? And your primary and secondary objectives should preferably be occupying 10 to 15% of the manuscript. After introduction, we have the material and method section, very important. We need to declare what type of study it is. There are various types of study. I will not go into the details, and we need to specify whether we have taken ethical approval or we have registered the RCT or the study in CTRI or not. And we need to mention the inclusion and exclusion criteria. There are various online guidelines available for various studies, like for RCTs, we have CONSORT, we have for observational studies, we have STROBE, for systematic review and meta-analysis, we have PRISMA. So we need to follow those guidelines to get qualified to submit, not to accept, to submit. So material and method section, we will have study design and setting. You have participants, inclusion and exclusion criteria, mention of ethical or CTRI approval, informed consent, the generalized flow or the protocol of the study, the data collection details, sample size calculation, and the methods of data analysis. After that, we will jump onto the statistical analysis, to do or not to do. So there is an option to do it yourself. If you are too much enthusiastic or very good in statistics, generally we refer to a statistician, because many a times these RCTs, cohorts, and case controls are little complex, and it's better to get the expert on board and get it done, right? Coming to results section, you need to again mention the sample size, basics, characteristics, the demographics has to be mentioned, the main results, again the results section should closely reflect the material and the methods section. So you need to actually correlate. And also secondary results should be provided separately, and this section should be written in past tense. So whenever we get the articles submitted to us, we will see all sorts of tenses. So it's not only the methodology that matters, also the English which is being written in the manuscript. Coming to discussion and conclusion, discussion section that provides the interpretation of the results, what I have found in my study and what others have found in the study, right? The first paragraph will summarize the main results in 2 to 3 lines or maybe up to 5 lines, and then subsequent paragraph should review the results in the context of available literature. So you cannot write the stories of Ramayana and Mahabharata. So let's say if I have found that pain reduction in knee pain, so for one particular intervention, so what others have found also has to be mentioned, right? If we have found comparable results, fine, we are happy. If we have found otherwise results, we need to defend ourselves. We will have our conclusion or explanation for that. And it's not that we always have to find the similar result what others have found. Otherwise, literature would not develop. Negative studies are welcome these days because we know that a lot of ghost studies are being done. So it is always welcome to do the get the negative results also, whatever is properly done. Need to mention the strengths and the weaknesses of the study, because building on that, the next studies will come up. An interested author would read this section very importantly, because they will know that what is shortcoming in this, if I add this, whether this would help to build up the evidence or not. And ends with the conclusion with not more than 1 or 2 sentences. Your conclusion should match your title and primary objective, right? References are the very, very important part, because we get, nowadays it's very easy because we have EndNote, Zotero, all those things, which actually will save your references as a serial number. The commonest styles used are Vancouver and APA style, but again, the journals have their own references selection. We need to do the acknowledgements, because only 5 people cannot do the study. If you want to acknowledge a company, if you want to acknowledge a institution, you can do that. At the end, you need to declare the conflict of interest. As I said, there is a separate form for that. And plagiarism and language is very important. So these days, AI has blessed us with a lot of power. So you can write a manuscript asking ChatGPT. But sadly, we also know that this is being done. So the journal has their own method to identify this. So role of AI in journal management, this I have put it today morning. I thought I'll put it because when the author can use the AI, the editor also can use the AI, right? So we know that whether it is being written by AI or not, we can actually find out. But other than that, what AI helps us is like to find out the content enhancement for your article, the peer review assistance. Many times our reviewers are very busy in practice, in personal life, so we keep disturbing them. So they can help us in this editorial workflow, yes, tracking the manuscript across the submission. They will help us with ethics and integrity, again, detection of data fabrication, duplication, and inappropriate image reuse. This is very important because we never give credit to the image we take from somebody or some books. So having said that, I'll go back. So after that, so this is the, whatever I have talked about is the hourglass structure of manuscript. So it starts with a broad literature review in the introduction, identifying the knowledge gap and the research question with primary objective and the secondary objective. Then comes the results, the research answer. Because what question you have asked, you will get the answer, and then comes the results, analysis, and the discussion. Very important slide for all of us is the peer review process. It is to be understood that the editorial team works very hard to get your paper published until otherwise. So this is the peer review process. So when you run with your manuscript, so these people are waiting to stop you. This is the commonest feeling. It's not like that. So there are various stages where the peer review process, when the author submits, the first instance itself, it can be rejected because it may not be at the scope of the journal, right? Then it will be sent to the reviewers. Reviewer may not like it. So reviewer will give some comments, depending on that can be rejected, or maybe some corrections are asked, and after the corrections, it can be addressed by the editor. It can be rejected again if they are not in proper corrected form. If not, then it is accepted. So to accept from the submission, this is a long process. So many a times it happens that why my paper is not being accepted. So this is because these are the processes has to be followed as per journal protocol. And after that, after acceptance to production, again this is the production media. So it's not in our hand. So again, that also takes time. This is the hierarchy of evidence. So my suggestion or request is, if you wish to, wish to do or contribute to the evidence, you may start with case series or case reports, but that do not help us in generating evidence. Try doing some RCTs, and then probably after that, meta-analysis and systematic reviews. So having said that, what is the scope of research and publication in pain medicine? It's immense. So we have pain physiology, pain epigenetics is coming up in a long way, receptor-based pharmacotherapy, nanotechnology, molecular, and whatnot. More importantly, I would say the epidemiological research is more needed because it will help us getting more attention towards the policymakers to bring changes, recognize pain as a specialty, also to advocate research funding, and easy to do. We have exclusive pain journals. I have put Indian Journal of Pain here because it was recently Scopus indexed, so I request all of you to submit your papers to Indian Journal of Pain, giving it a try. We have a lot of strategies to improve. We are not perfect, and we need to do some capacity building. Such a big conference should include a session on how to write a paper, how to submit a paper, right? It's my request to the organizers. Publication mandates, we have in our FIPM curriculum that you should have one publication. Collaborative research networks we need to build up. Funding and infrastructure, again, is one of the most important part is given to the institutions. Probably the societies should come up with more funding for improving the research in pain medicine. We need to focus on relevant areas which is pertaining to India. Probably cancer pain and interventions, low-cost intervention techniques, and because evidence-based integration of regenerative therapy, all those can be tried. Journals and visibility, we have our own 1 or 2 journals in India for pain. Probably we can actually improve the quality and get a global visibility. This I have already shown. Thank you so much. These are the 2 very close to heart journals. This is Indian Journal of Pain, and this is Journal of Musculoskeletal Pain and Ultrasound and Pain Medicine. So we are trying to improve the journals. It cannot be done without your help. So please submit your papers to these journals so that we can actually improve the journals. Thank you.
Thank you, Dr. Samarjit, for wonderful presentation. Now.
Thank you, sir. Thank you for this insightful lecture. Now I invite all the speakers of this session on pain and interventions and more onto the dais for the question and answer session and photograph. Dr. Shalina Chandran ma'am, Dr. Gaurav Sharma sir, Dr. Ravi Shankar Sharma sir, Dr. Amarnath Reddy sir, Dr. Sai Janni ma'am, Dr. Gopinath and Raju sir, Dr. Jeshnu Topal sir, and Dr. Samarjit sir.
Hello? Any question from the audience? Any doubts to be clear? Okay.
Yes, sir. Sir, it's extra foraminal, sir. Yes. Yes. We do not. Yes, we do not.
So it is extra for us.
Yes, sir, extra.
And no, हो गया.
Any question? Good.
Sir, I am past editor.
Yeah.
Sir.
I just want to know your comment on the thing. Like when you send a paper,
Sir.
it is sent to 2 or 3 reviewers. But what new trend I am seeing, when you comply to the request or the suggestions to the reviewers, you get another set of questions by the new reviewers. So you satisfy them, and third time you get 3 new questions, same were satisfied the first time. So you keep changing your manuscript, and in the last, what happens? I give you my example, that I was writing a paper in which a volume was defined. By decreasing the number of the text, the actual volume was removed from the main text. And then on the, you see, here we can tolerate all those things, but when it goes to the international level, they criticize it very badly. So how to deal with that? Are you doing something to prevent this?
Sir, actually, see, if the reviewer is giving a comment based on scientific evidence, and you have an answer to that with a suggestion of scientific evidence that no, I use this volume because this study has shown that this is useful, I don't think it's an issue. But if your case is unique, probably we would look into as a separate case, like why it has happened, definitely. But generally what we do, we send it to 3 to 4 reviewers. Every reviewer will not accept it. So the reviewer crunch is one of the, it's an, what to say, epidemic. We can't find reviewers, okay? And it has happened to you also, I'm sure. I have sent you and you were not available. And I understand that because of the personal reasons also, probably the reviewers cannot respond. So that happens because we are not having reviewers, enough reviewers. Probably we are trying to get on board of all the, even young people also we are including these days. So that problem has been addressed, if I am not wrong, but if it is there, we will definitely look into it.
And sometimes what's happening, sir, some of the reviewers give their comment. Like we have invited 5 reviewers, and 2 of them has already given the comment. And the third reviewer, what he does, whenever we have sent you for the first revision, he gives comment at that moment. So we have to include that. Yeah, that's the major issue.
Any more question?
Case report and all, you don't need IC approvals. You can straight away submit it. We have a lot of publications from private clinics. For private practitioners, for Indian Journal of Pain, we started images in anesthesiology, in pain medicine. One section is there because we did not want you to write a long, you don't have time, right? As far as RCT is concerned, for studies, there are local IC bodies you need to contact in your state or the area. In that area, there will be local IC bodies. If you can pay something, there is something called registration of those local ICs. Your clinic has to be registered there. They will give you some set of documents which comply to that. And you can actually do under their guidance. So I think, where are you from? Bangalore, there are very good number of local IC bodies. You can get in touch with them. Another suggestion is you get collaboration with some private medical college, get some co-PI or co-investigators from their institute, and you can actually submit your RCT or the study in their IC.
Otherwise, you can do case series, case reports, and review articles. 3 things.
Regarding this
I work in a corporate hospital. Their policy is any procedure has to be through a daycare admission and to be done in a procedural room. So it's not a pure OT, but it's a kind of a C-arm and a sterile table. Basically, we have a cath lab also. So sometimes most of the procedures I do in the cath lab. No, personally I don't, especially for cervical epidurals and other patients, I do keep epidurals, but not for these kind of patients. But if I feel that the patient is too anxious or if any previous history of any syncopal, then I try to be on a safer side, I put an epidural. But I think some people will put get a second IV line in every patient actually.
I do even for trigger point injections, everything, because because when they have vasovagal, no, that time it's difficult to get a vein also, and so.
I think that all the questions are over, and now I am concluding the session and then proceed to the lunch break. I think so. Oh, you will continue. Sorry. The scientific session will be continued. Okay.
Yes, ma'am.